Hi, my name's Katana. I'm a pharmacy technician student. How can I help you today?
Hi, I've just been diagnosed with type 2 diabetes and I've been having trouble using my monitor, so the pharmacist sent me over to you.
Okay, sounds good. Well, looking at your prescription here, it looks like your doctor has instructed you to test twice a day, sometimes before meals and sometimes 2 hours after meals. For your target for before meals, it is 4 to 7 millimoles per liter.
Okay.
And for 2 hours after, it is 5 to 10 millimoles per liter. Does that sound right?
Yeah, it does.
All right, and you said you're having a bit of trouble using this?
Mm-hmm.
All right, well, I'm just gonna take a few minutes to show you how to use it. So first thing you want to do is wash your hands really well with warm soapy water.
Okay.
And then we will start with our lancing device, small part here.
Mm-hmm.
Just get the lancet. So first what you want to do is take the cap off and grab a new lancet from your bag. Push the lancet into the device until it clicks, and then twist the cap off, but save the cap as you'll need it for later to safely remove the lancet. And then put the lancing device cap back on.
Okay.
And then pull the slider back until it clicks. If it hasn't clicked, it just means it's already ready to go, but if you want to confirm, you can just press the button and pull it back, and you can hear it click.
Yeah.
And on the bottom here, this is the depth that the lancet is going in. So the smaller numbers are shallower, and the deeper numbers, the bigger numbers are, it means it'll go deeper.
Okay.
But since you're just starting, we'll stick to 4. But as you get more comfortable, if you notice that you have too much blood or too little blood, you can always adjust the numbers later.
All right.
So now that that's ready, we'll set it to the side and get our meter ready. And to do that, we will get a new test strip from our little container here. Get one of those and make sure you close it up right away. Then you want to insert it prongs first with the gold side and the little strip facing up. This will turn the device on. And once that little blood drop is flashing, that means you are ready to take your sample. And once you put your test strip in, you'll have 2 minutes to complete it. And then it will turn off just to conserve battery. So when you are using the lancing device, you'll want to get the side of your finger, and if you're having trouble deciding where to go, you can put your fingers together like this and just see the side of your finger. Put the device up to your finger and then press the button.
Mm-hmm.
Remove the device, and then if you need to, you can massage towards the end of your finger because you need a drop of blood. If the blood smears or runs a little bit, don't use that sample, wipe it up, and then get a new drop of blood. And if you're feeling shaky, you can just put the meter on a flat surface and put your finger all the way up to the strip like this, and this will draw up all the blood, and then the device will count down from 5, and then it will show you your reading, and it will show the unit of measurement, it will show the date and time, and it will show if you're in range or not. If the arrow is pointing towards the blue, your blood glucose is too low. If it's green, it's in range. If it's pointing towards the red, it's too high. And also, when you are using your lancing device, make sure to use a different spot every time just to prevent soreness or calluses or anything like that. So when you're done, remove the test strip and put it into a sharps container because it has blood on it. And then you'll need to remove your lancet from your lancing device. Just take the cap off, and with the lancet cover, just poke it into the center like that, and then point it downwards and push the slider forwards.
Mm-hmm.
This will eject it. Put that into a sharps container as well, and then put the cap back on. Place your device into its carrying case as well as the lancing device, and wash your hands when you're all done.
Okay.
Did you have any questions?
So what happens after the 2 minutes is up and it shuts down? How do I turn it back on?
All you need to do is take the test strip out and put it back in, and it will reset
Okay.
it. Mm-hmm. Well, I'll just get you to teach it back to me so I know you know how to use it.
Alright. So first wash my hands.
Mm-hmm.
I want to make sure they're clean and warm. Then I'll begin with the lancing device and the lancet. I'll twist off the cap, set it aside. I'll take this lancet small side down, put it in. I'll twist off and pull the cap, and I'll keep it for later. Then I put on the top of the device, and I can set this to wherever I feel for the depth. And then I'll pull down, and if it doesn't click, I can just make sure it's set by pressing that. And there, now it clicks, so I know it's good. And then I'll go with the monitor. I'll take that out, and I'll get a new testing strip. Close that up. And then I'll put this in with the fork side down. And now it's on, so I have 2 minutes. And then I'll make sure to use the side of my finger where I can see, and I'll press it, and then I would click and massage to get more of a droplet. Then I can just put it on the side of the thing here, and it'll count down and give me my reading, and I'll be able to check my target because it'll say on there what the number is.
Mm-hmm.
So after that, I think I'm just good to take this out, discard in the sharps, and then I can put this back in its container. And then I'll take the lancet out and carefully poke it into here, and then push, and it flies out. And then I'll also put this in the sharps. Can I use those more than once, or I guess if I'm throwing them out, I can't?
Yeah, I should have mentioned that earlier, but always use one lancet and one test strip at a time. Always use a new one when you're testing.
Always new. Okay, that's good. And then I just put this away. Where do I put it?
So it comes with this little baggie here, and you can just keep it in there. And for storage, try to store it always in its carrying case and in its little baggie, usually at room temperature in a dry place. Keep it out of direct sunlight. If you need to clean it, if you notice something on there, just use regular soap and a damp cloth and wipe it off. And try to keep water out of the little port area on the glucose meter.
Okay.
Did you have any more questions?
I don't think so. Well, I'll make sure to wash my hands after I'm all finished.
Yes,
then.
make sure you wash your hands.
Yeah, I don't think I have any other questions.
All right, yeah, other than that, I think you're good. If you have any more questions, there's little guides in the box that comes with each bottle. So
Good to know.
Mhm.
Thank you so much.
Yeah, you're welcome. Have a good day.
You too.